Hi, my name is Misty Smith. I'm a licensed professional counselor and I offer exclusively online therapy for people in Michigan and Florida. And today I wanted to spend some time talking about what is probably the most common question or presenting symptom for the majority of my clients, and that's anxiety. If you've ever wondered what anxiety is, what the symptoms of anxiety might be, and probably most importantly, how to treat and manage anxiety, then stay tuned, watch this video. There's going to be a lot of good information. And if you like what you hear, please hit the like button. I would love if you would subscribe, and let's just get into it. So, one of the first concepts that I get asked a lot is, what exactly is anxiety? How do I know if I have anxiety or if it's just everyday stress? And so one of the things that I often share with my clients is that anxiety is basically the body's warning system. It's a physiological and psychological response to something that your body or mind has determined is a danger. And so when it feels like it is in danger, or it feels like there is something going on that isn't quite right, it sends warning bells in your head. And this can look a lot of different ways. One of the things to kind of remember is that, quite frankly, it can be faulty. And so with people who have anxiety, particularly those with extreme anxiety, that warning system is kind of broken. Think about like a fire alarm, or the fire detectors in your house, smoke detectors in your house. If the batteries are low, sometimes they'll just go off randomly. That's kind of the same concept. If your warning system in your body is kind of faulty, then it'll go off randomly and for what seems like no reason, but for you it feels very real. The danger seems like it's imminent. One of the things that I often get asked is, what does anxiety look like? And the truth is, it varies from person to person. For some people, anxiety is severe. It is, chronic, consistent panic attacks that look like everything from shortness of breath and inability to take a breath. Your heart's racing. You feel like you're crawling out of your skin. Your mind is racing 100 miles an hour and it just won't stop. For other people, anxiety is like a dull quell. It's a constant feeling of unease. It's just this steady state of feeling unstable or uncertain and nervous. And it's just constantly there. And there's no real reason for it. You can't necessarily identify what's going on, but you feel it. And it's constantly there for you. One of the questions that I get asked a lot, and what I want to spend a lot of time focusing on, is how to deal with anxiety. And the truth is, there are hundreds, if not more, coping skills that you can use for managing symptoms of anxiety. If you do a simple Google search, you're going to come up with a whole bunch of articles that talk about this. But I want to talk about a few that I think are the most effective, and that I use myself and or prescribe to my clients when they're struggling with anxiety. So the first couple of tips that I want to use are particularly useful when it comes to panic attack or significant anxiety. And these coping skills are meant to basically snap you out of that mode pretty instantly. And so the first one that I want to talk about is ice or ice splashes. Ice is obviously extremely cold, and when it is introduced to your body, it creates this physiological response. And so basically, when I have a client who's having a panic attack or feels like they're about to have a panic attack, I will tell them to get some ice, or get like a pack of frozen veggies out of the freezer, or get a bucket of super ice cold water. And basically, you're going to expose your body to that element. So you're going to hold the ice in the palm of your hand, put it on your wrist, or you're going to put your face in the bucket of water for a few seconds. Obviously, don't drown yourself. But basically what happens is you create a series of physiological responses. So our brain, for as smart and as amazing as it is, it really kind of can't do two things at once. What I always tell my clients is that your brain can't continue to be in a state of panic and figure out why the hell you're freezing it to death at the same time. So basically what it does is when you introduce ice, your brain senses a new danger. What the hell is going on? Why am I cold? And so it sends all of its energy to the spot of your body that has just been exposed, your face, your hand, your wrist, whatever the case may be. And what that does is it snaps you out of that panic moment. Because again, for as amazing as the brain is, it really can't do two things at once, at least not to that capacity. And so what happens is your heart rate lowers, your breathing returns to normal, and all of the physiological and mental side effects or symptoms of that panic attack subside, because now your brain is, again, trying to figure out why you're trying to freeze it to death. So ice is probably one of the most effective in the moment coping skills that I recommend for my clients. The second one is what I call 5, 4, 3, 2, 1, and there are a dozen variations of this. They all kind of do the same thing. The basic premise is to identify 5 objects in front of you. What do they look like? What color are they? Are they big? Are they small? Take a few seconds, a few moments to really focus on those 5 objects. Maybe you have a cup sitting on your desk. Maybe you have a warm blanket in front of you. Maybe your dog is sitting in the room with you. Really focus on those five objects. Next, what can you smell? Identify 4 smells. Maybe you cook breakfast that morning and the smell of bacon kind of lingers in the air. Maybe you put on perfume and you can smell it. Maybe you can smell the grass, fresh cut grass outside. So take a moment, take some deep breaths, try to smell what is in your environment. 3, identify 3 things that you can touch. What can you put in your hand and what does that feel like? Is it soft? Is it warm? Is it sharp? Maybe, again, you can feel a soft blanket, or maybe you have like a fidget on your desk that you can use. I always have a nail file. My clients know this. I wear on my sleeve that I have some attention issues and concentration issues, and my way of coping with that is to use a distraction tool. And so I always have a nail file, and I can feel the roughness, the sharpness of it. 2, is there anything that you can taste? Do you have a bottle of soda sitting next to you? Do you have some chips? Can you taste, residue from breakfast this morning that kind of lingers on your teeth and on your tongue? And probably the most important, number 1, is to take 1 deep breath. Deep breathing is a huge component when it comes to managing anxiety. And again, there are 100 different videos with 100 different ways to tell you how to do this. What I'm going to tell you is that I firmly believe that we exhale the negative energy out. I don't care how you do the rest of your breathing, but at the end of the day, you want to release that negative energy. And so when I do this with my clients, I tell them to exhale through their mouth, literally to put that negative energy back out into the atmosphere, and get it out of your body. So 1 good deep breath out, and then you have completed that exercise. That is called a grounding technique. Basically, the premise of that is to recenter you in the here and now. Anxiety is all about the future. It is all about control and worrying about things that are outside of our control. When you reground yourself, you are focusing on the present. You're focusing on the things that you can control now. A water bottle, a smell, a taste, a deep breath. And it snaps your brain out of that futuristic anxiety mode and forces it to look and feel grounded in the present. What are the tangible things that are going on in this moment? So those are really good overall skills. That they're especially effective, like I said, for panic attacks or severe anxiety. But oftentimes I have clients who have what I call just kind of a constant state of anxiety. And these are the folks that they really can't explain it. They can't identify what it is, but they just constantly feel unsteady, nervous, a feeling of unease, always like they're waiting for the other shoe to drop. And so for them, while those techniques will work 100%, I think it's a little bit more beneficial to take some time and do some deep dive into the anxiety itself and kind of start working on the cognitive piece to it. Now, if you were my client, one of the things that we would talk very heavily about is the idea of picking apart your own logic and what that looks like. For most people, two things. I always use the analogy, and I got to be honest, I got this from a client years ago, so credit to him. But anxiety for a lot of people is like having a whole bunch of glass balls inside your head. Every single thought, every single entity that's in your head is a glass ball. And if it drops, it shatters. And all you are trying to do is juggle all of these glass balls to keep them from shattering all over the floor. The truth of the matter is, 90% of the shit that's in our head are rubber balls. They're rubber balls that will bounce and they will not shatter and the world will not end if they fall. So how do you tell the difference? Well, this can be difficult if you have anxiety, but it really is good to challenge your own logic. We'll talk more on that later. And to start identifying what is a rubber ball and what is a glass ball. So I'm going to give you just a few examples. If you get hit by a car, that's a glass ball. Get your ass to the emergency room, get it taken care of. Clearly you need to take care of that situation right now. Let's say you're going to a bridal shower in a couple of weeks for your sister, and you bought your dress, you're super excited, but now all of a sudden all you can think about is how much your sister's going to hate your dress and it's going to ruin her bridal shower and she's going to be so mad at you and you just can't stop thinking about this bridal shower. This is a rubber ball, and these are the reasons why. First off, this isn't for a month yet. Why are you worrying about it in this moment? Secondly, let's look at this from a logical perspective. If she is having a bridal shower, the truth of the matter is she has 500 things going through her mind, and your dress probably isn't even in the top 10, let's be honest. And so you're worrying about something that A, hasn't happened yet, and that B, you don't even know is going to happen. And so again, recognizing the difference between the glass balls, that I need to take care of this and I need to handle this right now, and the rubber balls, that you can let them bounce for a while. You can let them bounce, you can let them hang out. They're not going to cause any harm to you. They're not going to cause any harm to another. And that kind of brings me to what I personally think is probably the most important coping skill and technique that I teach to my clients, and that is the idea of picking apart your own logic. One of my favorite things to do when I am working with a client who has anxiety is to ask them why. Why do you tell yourself that is true? Why does that make sense to you? If you use your rational brain, can you then say that that is a logical and reasonable choice or outcome or thought process? I'm going to give you a few examples. Had a client many, many years ago, sharing this with permission, by the way, that was very, very concerned about a tree that was in their backyard. This client had had a child and was convinced that this child was going to climb the tree, fall out of the tree, and die. And so one of the things that we talked about was really picking apart that logic. And one of the things that I asked this client was, have you ever climbed a tree? This client was like, oh yeah, back in my day, we climbed trees. Like we had all these really large maples and, my sister and I loved to climb the trees and, it was so much fun. We had like a little tree house up there, etc. And so I said, okay, did you ever fall out? No. Okay. Did your sister ever fall? Well, yeah, she fell out once. Well, what happened? Oh, she sprained her wrist. Okay. So let's think about this from a logical perspective. The anxiety part of you is making a lot of assumptions. A, you're assuming that your child is going to climb the tree, and maybe your kid ain't into that. Second, you're assuming that if they climb the tree, they're going to fall out. And again, that's facts, not an evidence. Third, you're assuming that if they fall out, they're going to die. And the truth of the matter is, none of that is factual or logical or reasonable. Is it possible that they'll climb the tree? Sure. Is it possible that they'll fall out? Yep. Is it possible that they might die? Sure, I suppose. I can't say that it 100% won't happen, but I also can't say that it 100% will, and neither can you. And so again, using rational and reasonable thinking skills to pick apart your own logic. I encourage clients heavily when they're in session with me to sit back and think about what is reasonable. What makes sense? If a friend came to you and said what you just said to me, what would you tell them? How would you respond? Would you tell them that they're batshit fucking crazy because they're worried about their kid falling out of a tree when their kid is literally 3 days old? Or would you be like, yeah, that's totally reasonable? Most likely, you would tell them that that's not reasonable. And so again, picking apart your own logic. Anxiety comes from our emotional space. It's a worry, again, as I said earlier, it's a worry about the future. It's a worry about things that we can't control. Anxiety is all about control. When we can use our logical space, our logical brain, those reasoning and deductive skills that we learn, from the time we're infants all the way to adulthood, then we can pick apart and understand what is and isn't truly rational, logical, reasonable conclusions to everyday situations, whether it's worrying about a dress, whether it's worrying about your kid falling out of a tree, whether it's worrying about what people at work are thinking about you, or worrying about your family that has different political views than you, or, all of these things that we allow to live rent-free in our head. If we use the picking apart our logic and we use those rational skill sets, then we can at least mitigate, if not eliminate, a lot of the anxiety that we feel. And so this brings me to probably what I think is something that a lot of therapists, I'm not going to say that they do it wrong, but I think that there's not necessarily enough focus on what I call proactive coping skills. So what I just taught you, the 5, 4, 3, 2, 1, the using ice, those are reactive coping skills. Those are things that you do when you're in the moment, when the anxiety has hit. Looking at rubber balls versus glass balls, looking at picking apart your own logic, those are proactive coping skills. Those are things that you can do in advance when you find yourself in a situation or starting to have worrisome thoughts or anxious feelings. In my opinion, while it's great to have reactionary coping skills, you need to know how to stop the anxiety, you need to know how to stop the panic attack, all of those things, 100% valid. I also think that it's important that we take a proactive approach. How do you learn to challenge your own logic? How do you learn to quell those thoughts before they become full-blown panic or become full-blown glass balls that now live rent-free in your head? And so, again, using both a combination of proactive and reactive coping skills to manage symptoms of the anxiety. So, final thoughts. I gave you a lot of information today, and I think that all of it is valid and useful. But what I will say is there truly is no substitute for therapy. A really good therapist is going to give you a number of coping skills, and some will work really well for you, and you're going to find that some don't. But it's about trial and error and working with a therapist that can hone in on what's going to work for you. But also talking through and processing all of the things that are causing and creating this anxiety in you. In addition to that, there are obviously other interventions. There's medications that can help with anxiety. There are medications that can help with panic attack. I'm not going to sit here and tell you that that is the best or prescribed course to take, but it's absolutely an option. And so if you find yourself struggling with anxiety, whether it's that dull, deady ache, or it is a constant feeling of being, on edge or full-blown panic attack, I 100% encourage you to find a therapist. And I would love to schedule a free consult or work with you if you think that this would be a good fit. But at the end of the day, finding a therapist that will work with you and give you the coping skills that you need, I think is probably the best solution for the most positive outcomes. So that's my spiel on anxiety. I genuinely hope that this video was helpful. I would love feedback. I would also love to know, what other issues do y'all deal with? Like, what could you use coping skills for? What are topics that you would like to explore more? Please leave a comment down below and let me know what it is that you would love for me to talk about next. And I will for sure make some videos on those topics. So again, I hope that you found this helpful. I would love if you would push the like button. If you want to subscribe, that would be fantastic. And I will see you in my next video. Thank you.